Good evening and welcome to The Square. Tonight's discussion is a very interesting and timely one. We're going to look at digital health in Rwanda. And on this particular topic, we're going to look at the interventions in this field, as well as the infrastructure that enables digital health systems in the country, and also looking at the future, what lies for digital health in Rwanda, looking forward in the next, 1 or 2 decades. And with us, we have guests who are not only experts in this field, but are actually implementers in the field of digital health. And I'll start with our first Byamukama, Siobhan Byamukama, who is here as the Managing Director of Babyl Rwanda. Great to have you on the show, Siobhan.
Thank you.
We're also joined all the way from RISA by Antoine Sebera, and Antoine is the Government Chief Innovation Officer at the Rwanda Information Society Authority. Antoine, great to have you on The Square.
Thanks for having me.
Great. My name is Dana Mpisi. I am the host of The Square. As always, I'm joined by the resident panelists, Berna and Charles. Berna Namata and Charles Haba are not here with us today, but it gives me even more opportunities to have guests in studio. So Siobhan and Antoine, great to have you on the show.
Thank you.
Great.
Thank you.
And to our viewers, thank you for tuning in. Please keep the conversation going on the social media using #TheSquareRW. So as I said earlier on, we are looking at digital health in Rwanda, interventions, infrastructure, as well as looking towards the future. But before we do, I'd like to just kick off the discussion with a couple of tweets that we've had before the show begins. Before the show began today, we had a couple of tweets that came in, and I'd like to read them. And the first tweet we have is from someone called Mhano. Hano Gilles Orest states that, I appreciate the effort with which has been put in developing the digital health sector, and I see a better future in this sector. But I want to ask RISA Rwanda, and I think this is to you, Tony, what they're holding for youth in digital health technology. Before we come to you, Tony, we'll go to the next tweet, and the next tweet is from Justin. And Justin Hera says that most studies have shown that empathy, time, and attention are what e-patients need most from their physicians. Cooperation between technology and healthcare is not enough on its own. The most decisive factor is the return of the human touch and reciprocal communication. So he's talking about the human touch. And Babyl, I know a lot of what you do is in telemedicine, and we'll get back to that very quickly, Siobhan. And the last tweet before we kick off the discussion is from Frank Shumbusho. And Frank states that even under the usual normal circumstances, medical doctors here are still struggling to efficiently treat patients well into their hands. And I'm wondering how challenging it might be consulting, thus treating distant patients through a phone, application, or online. I think most of the viewers here want to understand digital health. They want to understand telemedicine. They want to understand telehealth, mobile health, and so on and so forth. And this is what we are here to discuss. This is what we're here to enlighten and inform our viewers about. So the first question is to do with intervention and infrastructure, to you, Siobhan, and to you, Tony. And broadly defined, digital health is the convergence of digital technologies to enhance the efficiency of healthcare delivery and make medicine more personalized and precise. So in 2016, Siobhan, Babyl Rwanda partnered with the government of Rwanda to increase citizens' access to digital healthcare. Rwanda is one of the few countries apparently across the world that has universal healthcare, e-healthcare actually. So in a nutshell, I've personally always wondered how Babyl works. How do you get doctors to diagnose, at least triage people who call in and describe their symptoms. So in a nutshell, just tell us what Babyl does and how your systems work in the field of digital health in Rwanda.
Oh, thank you very much. I'd like to first of all thank you very much for inviting me on The Square. I'm a big fan, so thank you very much.
Great to hear.
So you're right, we started in 2016, but we're part of a company called Babylon. It's a global company that started in 2014. Rwanda was the second country, actually, that we came to in 2016. We're now in 17 countries, but Rwanda was the second country we went to outside of, head office.
And head office is in the United Kingdom?
Pardon?
Head office is in the United Kingdom.
Yes. And so our mission is to provide accessible and affordable healthcare to everyone on earth. And it was relevant for us to go to, obviously, a developed country, but also to a developing country. Before we go to any country, we look at the operating environment. How do people in this particular place access healthcare? In Rwanda, for example, we realized that only 15% of the population have smartphones, but 80% of the populations have phones. Globally, our platform is accessed through the app. But that would mean 15% of the population, exactly. And we want to provide accessible and affordable healthcare to everyone on earth. And so we looked at Rwanda and then said, what do we do to provide accessible and affordable healthcare to everyone on earth? So we have a call center where people can access. We have a call center in our head office. We employ about 100 doctors, about part-time, 137 nurses who provide this care. And what happens is that somebody will dial *811# for you to be able to access our service. You'll make a small co-payment. We partner with Rama. We also partner with Mituwell, the universal healthcare system. Even when you're a private insurer, and encouraging also private insurance companies to join us. We are in conversations and have a few partnerships with Radiant and in conversations with Britain and looking to have more partnerships. And so when you make a small contribution, your normal contribution, on our platform we'll be able to then see this person has booked an appointment, right? When you book an appointment with us, apologies, when you book an appointment with us, then we on the back end, some of the things that we're looking at is this person that has booked an appointment, is this telephone number with this NID? Is the person, am I calling the right person? So we had to have a number of partnerships. One of the partnerships we had with NIDA to be able to do that. Because we're using universal health coverage, we then also look at RSSB to say, is this person current on the insurance? And so when you are...
And the insurance, in this case, you're also talking, I think, largely Mutuelle de Santé.
Mutuelle de Santé, Rama,
yes.
Or even a private insurance.
Okay. Even private insurance is accessible.
Yeah, but then we want to check, is this the right person that has called us? That's very important. You want to treat the right person, don't you? And then, is this person current on the insurance? And once you've done those two things, then we're able to call the patient. So the first person that calls you will be a nurse. So we do the calling. You don't call us. You just do *811#. We called you. There are conditions that are treated by digital health, but there are conditions that also are not treated. If you fall on a motor, for example, we're not the right partner for you. So a nurse will call you to sort of assess why are you calling us today, and so on. So there are certain conditions that can be dealt with digitally. And if this is a condition that we can treat, then they make an appointment with you to speak to a doctor. But if it's a condition that we don't treat, we'll also still be able to sort of guide you, give you the basic first aid and guide you where you need to go. When a doctor then speaks to you, they do a normal consultation. And I saw a tweet of saying, empathy and the doctors are trained. The doctors are trained to be empathetic on the phone. They go through a lot of training because it's the way of the future anyway. So the doctor is going to consult with you, just like a normal consultation. They will, ask you, what are you suffering and so on, and they'll come up with a couple of outcomes. If the doctor wants you to go and do a couple of more tests, they are going to refer you to, they'll give you a prescription, they'll give you a code for you to go and do your lab tests, or if you're supposed to get a prescription. So for you to go to a lab or a prescription, or to get your prescription, we've partnered with 418 health centers throughout the country.
Wow.
So that you can go and to your health center and
show the code.
Show the code. It's a 16-digit code. You wouldn't read it, but then when you get there, they know how to. They've integrated with us. You're able to then read that code and then see this is the person. These are the tests that the person is supposed to do, and they will do the tests. They will then put the results back into our system, and then a doctor will call you and conclude the consultation. The same goes with prescription. We've also partnered with...
Very quickly, this is based on the person's insurance, so it will be almost at no charge, right? When I go with my 16-digit code to get either a prescription or to be diagnosed, is it at an extra charge, or?
So it's exactly how you access your insurance.
If exactly,
you go,
yes.
if you go to if you have Mituwell and you go to a health center,
that's the same.
It's
way.
exactly how you're going to experience it. like you had gone physically. If you're in Rama, exactly the same way. You make
So
a
this is just
payment.
from on a digital format.
It's just a digital
Fantastic.
consultation, but everything else, laboratory prescription is done physically, but then we come and consult and complete the consultation. And the beauty of it is that, you know, if you are a busy person, sometimes you can take a whole day to, you know, go wait for your lab test and so on. If you need to go drop your blood, you go draw your blood, go home. We will call you and tell you, you know, what happens later. So we have 418 partner health pharmacies. 418 health centers.
Yes.
We have 126 pharmacies and clinics as well that you could go to and access your care. Yeah. We've partnered with the government of Rwanda. We have actually a 10-year contract with the government of Rwanda to be able to do that. So, which is a great partnership. Yeah,
fantastic.
So that's what we do.
You know, you've broken it down to me, and it's really, really that simple. It's basically an option of you not physically going, lining up for tests, lining up for prescriptions. It is done via USSD code. I mean, this is so it's even accessible to people who don't have smartphones or phones that have this app. So it's incredibly accessible, but it's also it eases how people access healthcare.
Absolutely, we believe that, you know, getting sick is difficult enough. Why should seeking healthcare be as complicated?
Absolutely.
You know, so our job is to make it easy for you to seek care when you need it. And we believe that early intervention is very critical. So sometimes, you know, you're not feeling well, it's a headache, you self-diagnose, you take your prescription, and this condition could probably get worse. And if you intervene early, if it's a headache, we are treating a headache. If it's simple malaria, we're treating simple malaria. If you wait, it gets something complicated.
Exactly.
And as citizens, obviously, you become unproductive. You get sick. Things get more complicated. So we believe that early intervention is very critical in the healthcare system.
Just very quickly, before I go to Tony, what are the numbers? What are the numbers in terms of how many, you know, how many people have you treated since 2016 or have gone through your system, and what's your target number, you know, in the next 10 years, that sort of thing. But if you can just start by telling us the numbers.
So in terms of registration on our platform, we have over 2 million people that have registered on our platform.
2 million Rwandans.
2 million Rwandans that have registered on our platform. That doesn't mean that we have treated 2 million people, because, you know, you register on, you know, you're watching TV, you're like, oh, this is interesting. Dial 811, register. You know, I will use it sometime. But then we've done over 1 million consultations since 2016 that we started. Every single day, we do about 3,000 consultations. Yeah.
That's great.
So one thing that maybe I need to add is the way we do it. So you can dial 811 hash, call from home. You can go to a health center. And of the 418 health centers that we've partnered with, we have put agents in 200 of those. I think over 200 actually of those health centers. So that when somebody goes to a health center, somebody's there to say, you know, have you tried a digital platform? This is how you use it. They walk you. That 20% of our patients actually call us from home. And we're monitoring that figure because that's the end goal. We don't want you to leave home unless you have to. So, yeah.
Great. Tony, thank you for coming here representing government, representing RISA, but also representing you know, people who are involved in enabling this digital health to happen in this space. And if you can just tell us from a government perspective, and also as a, you know, as an expert in this field, as a government chief innovation officer at RISA, what has the digital health landscape been like? Before you know, 2016, before Babyl came in, what has it been like and what is it like now? What infrastructure exists to enable the likes of Babyl to do the work that they do in Rwanda?
Also, I want to thank you for associating me on this important discussion. Sure. And Siobhan has just described it well, how you can use technology to change the way we're providing healthcare. And this is very well aligned to the ambition of the government to put really IT, technology, at the core of what we're doing, the service that we are doing. So this has been a very important pillar over the years, and we've started different initiatives for now close to a decade, connecting the hospitals, providing different applications and systems to empower the healthcare delivery professionals, and importantly, to make it vendor service very convenient to the citizen. Siobhan described how you can stay from the comfort of your home and still receive healthcare. You don't need to spend a lot of money in transportation. So we really we saw the potential. The government saw it and say, how do we make it really a tool to drive change? So to discuss a couple of things that have happened over the years, starting from the lowest administrative entity, where we have what we call community health workers. They've been using what we call rapid SMS as a system where they can report different information, they can assist pregnant women, they can assist young kids below 2 years old, they can assist in reporting malaria data. We've seen also some telemedicine coming into place, where you can have remote diagnosis. That's also how Babyl came. We've seen how we contributed to the capacity building of healthcare professionals through e-learning. Electronic medical record. Most of the hospital you go,
the EMR.
The EMR,
yes,
you find they have some digital tools. We've seen how we'll be able to exchange information between different hospitals. Some pilot projects have been put in place. We've seen how we've used technology in the supply chain of medicine, from where we purchase them, the efficient distribution, all the way down to the district pharmacies. And we've also seen how we automated the different touch points between the patient and the healthcare facilities, where they use RSSP services, essentially for health insurance, and many more. Essentially building the basic ground for more innovation, for more technology to make the service more efficient and convenient to Rwandans.
Yeah, but just also very quickly, that was the work that has been done in the last 10 years. And a lot of this is also to do with, the fact that the broadband connectivity across the country enables this sort of infrastructure to happen. But if you could also just briefly tell us what is the current situation right now? You've been talking about 10 years ago, but right now, from your perspective, are we on track with where we wanted to be? If you're talking about Vision 2020, are we on track on where we wanted to be in terms of digital infrastructure for sectors such as digital health at the moment?
Yes, we're very much on track. And this was proven during this pandemic, where we've seen how our system were robust enough to withstand the pressure on our healthcare facilities and to empower more, the doctors, the nurse to react quickly, tracking different issues that were there, here and there, and making sure government could continue to function. So that is thanks to investment that were made. You mentioned the broadband infrastructure. It's reaching every part of the country.
What is the coverage of what is the connectivity of broadband infrastructure across Rwanda?
We have two types. We have underground, which is essentially the fiber that is reaching all the corner of the country, essential building, couple of hospitals. And then we have a wireless infrastructure that we call 4G LTE. That's now reached 96% of the population. There's still some work to do in terms of making it more available and more affordable. We also discussed about the needs of having more smartphones. We right now at around 15%, but it's growing. We have a Made in Rwanda smartphone with Mara. So there's a lot of initiative on the ground that are really positioning Rwanda to better use digital technology in health as well as other sectors.
Other sectors,
And I can attest to that. When in 2018, when we said we're going to be everywhere, we did an exercise in health centers. And to be in 418 of, I think it's 508 health centers, we kind of said, okay, does this health, so we went to all the health centers. Does this health center have internet? Is there a computer? Is there connectivity? And we went in 418 health centers. This is 2018. But now we're increasing even the number of health centers because that criteria is even in more places. And in terms of phone penetration as well, when we started in 2016, the smartphone penetration at the time was 10%, and now it's growing 15%. And with the introduction of Mara, this is even going to be more. And we are keenly looking at the sort of like things that are happening because then we would like to then introduce an app at a future time. But our objective is to make sure it's accessible. So the more smartphone penetration there will be, the more services we'll be able to deliver.
Absolutely.
Absolutely.
Yeah.
And of course, a key component also is how we develop the digital skills. We started with people in the professional environment, but now we are going even more on the grassroots to train the majority of Rwanda, equip them with digital skills so they can do a lot more self-service using their phone and going together with the increase of smartphone penetration.
Absolutely.
Yeah. I just want to get to some of the tweets that we read before we go to the next aspect of the conversation. And the next aspect of the conversation is just understanding the impacts of the COVID-19 pandemic on Rwanda's digital health landscape. So how did Babyl, how did you navigate throughout this period? Also just hearing from Tony, how did government use innovative digital solutions to work, and manage the pandemic? And there's lots of that we're going to discuss. But one thing I picked up on the tweets was just that whole concept of, you could see there's a general worry of people in the public, digital health, e-health, it takes away that personal touch of doctors. And it's more like technology. Are we creating a sort of gap or a sort of, a huge space between that human touch of technology vis-a-vis doctors and patients? What do you have to say to that? And then after that, also to you, Tony, the tweet that came up to us on what government is doing for youth in the field of digital health.
Yeah. So I'm a strong advocate that in medical school or in everything that we do, I think that there has to be a course on digitalization. Absolutely. Because it's the way of the future. It's the way of the future.
It's the future.
And then later, I hope they get an opportunity to speak about our AI platform. And we just have to move with the times. And so it's very necessary. So in terms of when these doctors come to work with us, they go through a training. How do you become empathetic on the phone? These are doctors that are in King Faisal. We use our doctors part-time, but they all work in different health facilities.
Yes.
They work in all these hospitals, private hospitals, government hospitals, and they give their spare time to then work with us, But they go through a training, How do you become empathetic on the phone? How do you have these conversations on the phone? Because ultimately, think about when you go to see a doctor, what happens? They have a conversation like this with you. Is it the physical is it me seeing you? Actually, they make their diagnosis?
In some cases, you have physical one-on-one personal meetings with doctors, and the complete lack of empathy, the complete lack of double training in terms of how they've been trained as doctors, just people skills.
Yeah.
It's a huge, in terms of the patient, it just takes a lot away.
Absolutely.
So there's no really big difference if someone can be able to communicate and connect with someone on phone.
Exactly.
There's really no big difference. I think
there's no big difference because we train them on how to do digital consultations, and we've started in 2016. So obviously, some of the doctors that we've been with have been working for us for all this time. So they have mastered the art. And the focus for Babyl is trial service, see how it works, and then we see whether you are a repeat client, And for us to be able to do 3,000 consultations every single day is a testament. Because if it's a service that is not good, then people will not use it. But people are constantly using our service, repeating to use our service.
And
because
there's
of
an
that.
upward trajectory in your numbers. It keeps on growing each year.
Absolutely.
Yeah.
So we're doing 3,000 consultations. Previously, we were doing about 2,000, but there's a time we're doing significantly less consultation, even when we're offering them for completely free. So it's been an interesting journey. We had doctors initially. Working with us, how does it work? I wouldn't work with Babyl, but I need to physically, you'd have all that, happening in the mindset. But right now, we have surplus of doctors. We have doctors that would want to work with us, and it's just been an interesting journey. But I think that what is important is to think about what happens when you're in a physical room with a doctor. It's a conversation you're having with a doctor, right? That conversation can be on the phone, right? And then if the doctor thinks that you should do some tests, we have the ability to do prescriptions. We're able to do lab tests, So I think that is a mindset change, which I think that has been an interesting journey, and there's been a lot of mindset change, and we're getting there. Yeah.
Maybe if I can supplement a little bit, I think we shouldn't look at one or the other way. Technology is there to stay and is there to empower the doctors. Imagine you need empathy with the doctor in his presence, but imagine if you can continue discussing with the doctor even when you left the hospital. You can stay in touch. You can really feel a more intimate relationship with the doctor, where they can be able to follow you really on a regular basis, and having you engage also as a responsible person in your own healthcare.
Yeah, you're absolutely right. Because even when, most of the time when you see a doctor, you call your doctor and you talk over the phone, and the conversation keeps on going on. But Tony, very quickly, the question on youth empowerment or youth job creation in terms of skills, upskilling in the digital health space.
We're very supportive for the youth, especially young entrepreneurs. There's been a different program to support them, providing space, providing the right environment for them to translate their innovative ideas into products that they can bring on the market, eventually creating business and employment. So we've been focusing on providing these services in Kigali, in collaboration with the private sector and ICT Chamber, and we run different programs, different competition, different hackathons.
Yes, I've seen the hackathons.
Continuing to support them. We have different thematic groups in agriculture, in health, and digital health is part of it. And the great news is this year, we're going to expand even the service beyond Kigali, so that we provide equal opportunities to also other young and bright minds which have innovative ideas outside of Kigali, starting with the secondary cities, and we want to really cover everywhere across the country. And many things also are in place, policies to support the startups. We're looking at different framework also on how we can procure innovation in the government.
Yeah. Just before we go to the, we can't have this discussion without looking at the impacts of COVID-19, I said earlier on. Do you think and none of us are medical doctors here, but it's just a general question. Do you think digital skills or digital, the future is here, elements of telemedicine, mobile health should be incorporated, or, in courses of medicine, or when doctors are training, should some of these things be incorporated, looking at the next couple of years, looking at the future?
Absolutely. I mean, COVID-19 has shown us, even in the most developed countries, sometimes you watch the news in shock, and seeing how overwhelmed health facilities are. It doesn't matter that it's in America or London or somewhere else. And the health system gets, overwhelmed. And the way healthcare is done and the legacy systems, it's really important for us to open our eyes and see what is the future. Because you know what? COVID has happened. The world is going to change. So even when we finish COVID, 2025, whatever, the world is changing. And so we need, and I said at the beginning, we need to be able to incorporate our lives of digital into medicine, into education, into every aspect of our lives. I mean, if I think about, I'm not giving away my age, if I think about a while ago, like, what was I using internet for? Just emails. I didn't even, Google wasn't even there. But look at how information has just been democratized, accessible. It is the way of the future. This is, we just have to, sort of like embrace what the future looks like and just be ready for what's coming.
Tony?
Yes, I think it's very right. Now we're starting talking about the new normal. And the new normal is going to be increasingly digital. We're moving into digital first lives and society. And we see that economies that were prepared to withstand this crisis are economies that have made initial investment in digital tools and digital infrastructure.
That's true.
Those who did not had to struggle a lot. All of a sudden, we had to work from home. We had to continue business in that way. We had to get goods delivered through e-commerce, delivered online. We had to sign digitally. And what we saw was even quite interesting. A lot of things were done almost overnight. And this showed that we were already moving towards a digital world, predominantly. And maybe we were going a little bit slower, and that pushed us.
It fast-tracked us.
Yes.
We really fast-tracked
Yes.
because we had to react to this pandemic.
Yes.
So I think in the future, we'll have to think of resilient business models, being it in the private sector, be it in the government, to see how we can provide our business in whatever situation.
And so looking at, the COVID-19 pandemic, we saw how we had, and absolutely I agree when you say it was overnight, because for me it was, overnight where I just saw there were robots taking temperatures of people at the airport. There was data surveillance in terms of, from RBC, looking at contact tracing, there was lots of digital innovations, lots of use in terms of the digital health space in managing this pandemic. Tony, I'd like you to just share, just elaborate more than what I've said in terms of the infrastructure, the available infrastructure that enabled us as a country to manage this pandemic in the digital health space.
Sure, thanks that you mentioned the robot. That was not, those were not the first robots.
Yes.
I think the viewers are remembering Sophia.
Oh yeah, Sophia,
the famous Sophia that came,
and
you could interact with them, but no one really got a grasp of what robots could do.
Yeah.
And during this pandemic, we've seen how they can help screening people with abnormal temperature. They could go into areas where you wouldn't want to expose
essential care workers.
Yes. We've seen the drones, how they helped into awareness and also monitoring the violation to the lockdown. We've seen systems that were put in place for surveillance, early warning at the hospital, various facilities where they would see suspect case and quickly reporting. Talking about digital innovator, we've seen K-Lab, I'm not sure if you know it.
I know K-Lab. I know K-Lab very well. Yes.
They were able to manufacture protective gear.
Yes.
Face shield is a young innovator, and also they've been able to make a difference. We've seen different tools that were put in place, self-screening, using USSD on a feature phone. You could screen if you were having symptoms, and at a national level, we could identify where we could be having areas of risk. We've put, chatbots on WhatsApp for people who, at the beginning, did not know much about COVID-19, wanted to ask questions, and that was very helpful. We did a lot of data visualization, data modeling, to see what could be the next area of risk, so that we could have efficient decision making. We could really support, people who were at the front line into dealing with this pandemic. So a lot of initiatives were done by the government, but not only by the government. We saw also the entrepreneurs, some of them providing solution pro bono. So that's showed to us really a time of solidarity, also in the digital space, where we join our efforts and see how we could quickly respond to the pandemic.
Now, this is great, but it looks like it happened overnight, because it begs the question, so before COVID came and fast-tracked and brought to the fore these incredible digital innovative, skills that have really enabled Rwanda to manage the pandemic globally on a global scale, it's really commendable. What was happening before? What was the digital? I mean, I've asked you this question before, but to really ask, what is the future then? After COVID, I mean, COVID is here to stay for a while, but are we going to use this infrastructure even now more than ever, deliberately for other things, other situations?
Absolutely. A quick example would be, we were not used to work from home. But recently, some funny thing that happened when people were invited for a meeting, then what is not the usual way is to ask when they were informed that it was physical, they found it unusual. So the new normal is to have a meeting on Zoom, on WebEx.
Because I am someone who I detest
from
meetings.
The comfort of your space.
So having short meetings online, fantastic.
So we had this infrastructure, but no one ever tried
Yeah.
or ever authorized the employees to work
That's
from
true.
home.
That's true.
But today we are seeing changes. We're seeing big corporations across the world that will stop requesting for staff to be working from an office, because anywhere can be your office. And most of the time when we are at work, what we are dealing with is just digital tools. So
But I want to know in the digital health space.
Well, in the
This infrastructure that we're seeing in managing the COVID-19 pandemic, can you just tell us, are we, tell us, reassure us, I don't know, but is it here to stay for good? How can we incorporate it in our healthcare system?
It is, and I will discuss some of the innovation that we will be bringing in. Is first of all, we will digitalize end to end. Wherever you go, your information should be properly recorded. When you have a case, they can have visibility at national level, and then they can act quickly. Whenever there is a pandemic, that can be malaria cases that are raising in a certain area. We've seen some cases of Ebola in neighboring countries. So this is there to stay. Every country, and Rwanda included, have to be ready for any any outbreak.
Absolutely.
And we will continue providing convenience to services to Rwandans. And Babyl is actually one of the good examples,
Yes.
where we will not need you to go to the hospital, queuing, and really putting a lot of stress to the health facilities.
Exactly, exactly. Siobhan, very quickly before we go to, we're having lots of tweets coming in from our Twitter feed. What can you tell us about Babyl in terms of how it managed to continue doing its work, but if anything, contribute to national efforts, as Tony is telling us, national efforts in managing the COVID-19 pandemic in Rwanda?
So one of the things that is very critical for digital health generally is the pandemic is happening, COVID is here, or something else is probably here. But the person who has malaria still has malaria. Like life in the sick world,
it still continues.
still exists, right?
It still
and
exists,
it's continuing.
Yeah.
And so our contribution is a couple of folds. But one of the major contributions is the healthcare system dealing with the pandemic, and for us being able to treat people from home
Absolutely.
on the normal conditions that they were suffering from. Because when the COVID came, it doesn't mean that the malaria went down, or whatever it is that you're suffering went down. So that was a factor. And what that helps is support decongest health facilities so that they deal with the critically ill, and then others can work, can be at home. And actually during the lockdown and even thereafter, we saw the number of patients calling us from home significantly go up. At about 155% shoot up.
Wow.
Over
During this
services.
period.
Yeah, over services because of that, right? The second thing is that even for us, as I told you, we do about 3,000 consultations every day. In our protocols, every interaction or touch point that we have, we give COVID information. How to prevent it, symptoms to look out for, and we also do screening. And if we suspect that someone has the symptoms, we direct them to the RBC, the national way of dealing with COVID, and also check on them. Did you call? Did you do this? Did you, so just making sure that that these people is properly directed to the right place. The other thing also, we put an IVR system.
IVR meaning?
IVR. So when you call us, call center. So our call center is 8111. So when you call 8111, we'll give you healthcare information. IVR.
Interactive voice response.
Yeah.
Interactive voice response.
Yes,
okay.
yes. Giving you information on COVID-19, symptoms to look out for, what to do, different aspects of that, so that you have that information. Because I think with COVID, the most important thing, and the government did an amazing job, is information sharing. And so we did our part to provide that relevant information to be able to get there. Then the other thing also we did is, how can we allow doctors to work from home? So this doctor works in a place, maybe during the day he works in supporting COVID patients. And so if you're at home, how can you still provide care in the comfort of your home? So as I told you, we have a call center, but now what we do is that you're able to call from home. And this was important twofold, because right now the doctors that work with us have to live in Kigali. And so what we're saying is, how about doctors that live in the countryside?
Yeah.
Can they be able to work with us?
Yes. Yes.
Then lastly, and this is early conversations that we're having with RBC. As you know, there's now a shift for people to quarantine at home. So we're having early conversations with RBC to support people who are asymptomatic or mildly symptomatic, so that they're not left in their homes alone. We will call them, follow up with them, and just keep checking. If the person is become asymptomatic all through, this is something on a daily check that doctors will check up with you, and if the symptoms worsen, and then we can direct you. We can then have a protocol of directing you to seek further care, but so that we support people who are calling, who are staying at home, and are quarantining at home.
At home.
Yeah.
Great. We have a couple of tweets coming in, and I'd like to read them very quickly. I'm also seeing a tweet from some resident panelists who are not here. We'll get to Charles later on. But our first tweet is from Trésor, who says that, thank you, Rwanda Square. Do the digital work respond to the health equity issues, or it comes to serve those who haven't enough time to spend, to go to facilities? How can people from villages assess it, is what Trésor is saying. So Siobhan, that's to you. Just note that down. We'll come back to you very quickly. We also have a tweet from Charles Haba. Charles, thank you for tweeting in, even though you're not here on set. And he says that, when will Rwanda be digitally ready to effectively handle admissions and discharging at hospitals? It is annoyingly painful at literally all medical facilities, and the paperwork is archaic. Tony, that's something that you're going to answer shortly. We also have a tweet coming in from Wilson, a very interesting tweet, and Wilson states that, great discussion. As we attract foreign companies in Rwanda as a proof of concept nation, we need to think more about how companies like Babyl work with young Rwandans to ensure knowledge transfer. Is Babyl doing this? Is there a government to run the strategy on this? So knowledge transfer, thanks for that, Wilson. And our last tweet, so that we can have our guests answering the questions. Our last tweet comes from Vivien, who says that there is need to have centralized medical records for a well-informed digital health service delivery, and the two institutions represented today have a key role to play, mainly RISA. Any plan on this? So centralized medical records. I'll start with the first tweet. Siobhan, over to you.
So I think that...
and briefly, sorry, because
okay, so the tweets for me are two. One on equity, and then the other on knowledge transfer.
Exactly.
Yeah? So 80% of our patients are from the countryside. As I said, we have health facilities. We have 200 people going to health centers who help people to be able to access our service. And the objective here is to make sure that these patients, nobody is left behind. Someone physically shows you, this is how you dial 811#, try this service, they take you through the journey physically, and then you can do this at home. 80% of our patients actually are from the countryside, and the rest are from the cities. There was a study that we commissioned in 2018. It was a Dalbach study that showed a couple of things that were actually very interesting. Men are equally as likely as to use the service as women. Categorization, 1 to 4, there was an equal distribution of who is using our service and who's not using our service. And also age was not a major factor, because you would think it's something new, it's really, for the really young, youthful people.
But digital savvy.
Yeah, but it was really across all borders and all age groups. So that is the question on equity. Knowledge transfer. There's a lot of knowledge transfer that is taking place. I mean, personally, I'm a lawyer, but I know quite a bit about digital health, AI, and all that. So a lot of the support that we're getting right now, we have over 2,000 employees globally, engineers, doctors, tech-savvy people who support our system. And what we're looking to do is, how can Rwanda be supported by Rwanda? The objective in the long term is to have Rwanda as the head office for Africa, and to have the tech support to be here, done by Rwandans. So as a head office, obviously, there would be all these other services that would be here. And because of the huge because it's a global company, there's a lot of, especially with AI and technology and all these other places, there's so much knowledge transfer that is going on that does happen. So I think over to you, Tony.
Over to you, Tony.
I think the question from Charles and Vivien are somehow linked, and it's based on full digital experience and really having a superior experience for the patient. And to arrive at that, we're working towards having a single patient record. That's number one. When you visit different hospitals, you find your records are on one hospital, on Babyl.
But it's a digital file for one individual.
Digital file. So we sort of replicated the paper-based file in the digital world. So we're trying to simplify that so that when you go from one health facility to another, they can know you better. They can know you in advance. And we can empower more the doctors toward that. And a digital experience will go as far as you can know how you can reserve. You can schedule in advance. We've seen different applications in smart transport, for example. You can know when is the next bus coming. So technology is there. You can know, for example, how many people are in front of you in the queue. And Charles can enjoy a nice coffee while he's waiting. And just come a few minutes before and meet the doctor. So a lot of planning has been going on, and we're seeing the next 1 to 2 years being really prolific in terms of innovation in the digital health sector.
Fantastic. Last couple of tweets before we get to the end of the show. And, these tweets are coming in, and we're coming to the end of the show. This is the last tweet from Richard Rwanda, who says, I have 2 queries for Siobhan. 1, how do you ensure standards relating to data exchange, security, safety, and privacy to protect online patients? 2, how sustainable is the business model given the high maintenance costs of telemedicine systems?
Okay, so put back the tweet, please.
Can you go back to, let's just go back to Richard's tweet, but he's asking about the sustainability model regarding the high costs of telemedicine systems. So the tweet, yes.
So, first of all, when we come into a country, we make sure that we understand the regulatory environment in each country. In Rwanda specifically, all data is stored in Rwanda.
Yes.
We make sure that even if it's stored in Rwanda, all our data is encrypted. So to just make sure that it's safe.
And secure.
Also, being part of a global company, so we're in line with the Rwanda's regulatory environment, but also as a global company, we have specific standards, and we just make sure that as a country, as a company, in all the 17 countries that we operate, we have a standard. Data is very critical. Is the backbone of what we do, and making sure that it is safe is very critical for us. Second question
on the
is about
sustainable. How sustainable is your business model given the high costs of telemedicine systems? Are the costs really high in telemedicine?
So what happens is any business, any business across the world, there are initial investment costs that you're going to incur in telemedicine. Actually, telemedicine shouldn't be more expensive than a conventional care system because, you're utilizing a doctor when you need to utilize a doctor and so on. So it's something over time that will get cheaper. And so we have a sustainability model. We have profitability platform like any other business to then see this is how we'll get to a sustainable point. But, in any company, you would have, initial investments leading to sustainability. And actually, I think it's wrong to say that telemedicine is more expensive. It's not, actually. It's supposed to, for you to provide a service that is accessible and affordable. That is our mission. Our mission is to make sure that it is accessible and affordable to everyone on
Yeah,
Earth.
we have a tweet coming in from Brenna. Brenna, thanks for tweeting in. You and Charles are missed on tonight's show, but Brenna's tweets, and she's asking us, many thanks to our guests, how do we ensure the ongoing steady migration to e-health is inclusive and no one is left behind? We still have a huge digital gap. Tony, very quickly to you.
I think very quickly, we discussed a little bit, is to make sure that everyone is connected. As much as possible, getting smartphone in the hands of every Rwandan, and ensuring affordability of the services, and really equipping them with digital skills so that no one is left behind.
Yeah.
So this is really at the core of the digital transformation effort of the government.
Do you want to quickly answer on that, or? No, it's fine. Okay, so the last part of the discussion is, first of all, keep the tweets coming. Thank you very much to our viewers, and I really hope that our guests are really sharing insightful and informative content in terms of digital health. The future, Siobhan and Tony, what do you envision? What do you envisage for the future of digital health in this country? It's a small country, but it has been lauded. Rwanda has been lauded in the strides it has taken and ensure universal healthcare, but also universal e-healthcare based on partnerships such as yours, Babyl Rwanda, and Government of Rwanda. What do you envision for the future of digital health in Rwanda as your closing remarks? And over to you, Tony. After Siobhan, sorry. Yes.
So one of the things that we're doing, Diana, is in the very near future, we're going to introduce AI into our services. We will first of all introduce AI in our call center. So usually, we already use AI across the globe, but it's something that you use on your phone. It's an app that you use on your phone, and it's direct interaction with you. But because of smartphone penetration, which is definitely going up, but right now we are introducing AI in our call center so that when patients call us, they can interact with the AI. That is a first step.
So like an artificial intelligence doctor or nurse, or...
Well,
you don't need a physical human being there. Because
of the limitations we have in terms of what people have in their smartphone penetration being low, it will be a third-party interaction. So when you call our call center, it will be business as usual. You'll be interacting with a nurse on our side, but they'll be asking you these questions that you would ordinarily be asking, doing it for yourself on the phone over the AI. So we're doing that as a first step. And then as a second phase, we're also then introducing it as a pilot in a couple of health centers. So that when a patient goes to Health Center A, and by the way, it has been translated in Kinyarwanda.
Fantastic.
So when you go to Health Center A, you have a tablet, and then you can interact with the AI yourself before you go and see a doctor. And then what that does, it allows you to then see, is it an urgent care that I need to do right now? Is it something that can wait? Is it a red flag? Is it, what do I need to do? And then it will also be able to give you a differential. So you're probably suffering from this and this. It also equips you as a patient with the information that you need to have, because it's a conversation you need to have with your doctor about your health. So it equips you the information that you need to be able to have an interaction with your doctor. So, and then maybe last...
I'm sorry, I'll have to cut you short. But in a nutshell, AI, this is the future. This is what Babyl is bringing to the table. We have less than a minute left.
Less than a minute, real quickly. I think the future
yes.
is a better, superior patient experience, is addressing non-communicable diseases that are on the rise. And this we need to find efficient way, cost-effective for conducting massive screening. And of course, using more AI in diagnosis, supporting, really empowering the doctors and nurses, more robotics, that power decision at all levels.
And as someone involved in this field, you think this is something that can happen in the next decade or less than a decade in Rwanda?
I think a decade is too long.
It's too long. Fantastic.
We're getting it in 2 or 3 years maximum. We'll see.
We'll definitely have you on the show very soon, maybe in a year, just to catch up on.
Count on me.
Exactly. Thank you so much to our guests, Tony Sebera, Antoine Sebera, and Siobhan Biamukama. Thank you so much for joining us. To our viewers, thank you so much for tweeting and messaging us on social media. Keep the tweets coming through using hashtag #TheSquareRW. I'd also like to take this opportunity to thank our partners, Uzi Collections, as well as Bourbon Coffee, for always supporting the Square Rwanda. Thank you for tuning in. Have a good night. See you again next week.